Folks, thanks for coming on the line with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing the ways and means of insurance professionals working with providers. Today's topic is intended to help you ease into relationships, establish relationships with those medical professionals who deliver upon the care that you are purporting to cover through the use of your products that you sell with base medical or ancillary products. Today's presentation is being recorded, and it, along with much of the information we reference throughout the course of the presentation, will be sent by email to everyone who RSVP'd to today's meeting. Keep in mind there are attachments and links in that email, and it is blind copied to the group, so it may go into your spam filter if yours is particularly aggressive. We apologize for that, but I don't know how else to do it. If you'll note as well on the software, there's a section within it for questions. Please type in your questions as they occur to you. Keep in mind we do cover many of them throughout the course of the presentation, but we will check and make certain that they are addressed and you get the answer that you are after. Well, at least the answer that is fair and is truthful. So as a bit of a level set to start, let's talk about who Premier Marketing is. It's a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We have offices across the country, and we act as an insurance wholesaler working through independent insurance agents such as yourself. We do so through a contracting arrangement that brings about the highest possible commission levels, and there are recruiting contracts available to those who qualify. That full portfolio includes the base Medicare programs, the Medicare Advantage and Medicare Supplement programs, and standalone Part D prescription drug plans. But it also includes life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits such as the dental, vision, hearing products, and the critical illness cancer programs, hospital indemnity programs. You'll notice in this portfolio, this is a listing of, in a manner of speaking, of programs that access providers that we can work with in order to make certain that we cover everything that they need and take care of the provider as well. That Medicare Advantage portfolio includes all the national carriers and many of the regional carriers that can make a difference for you in your market. And that same philosophy carries over into the standalone PDP portfolio, where the national leaders are there for you through our organization. When you look at Medicare supplements, which is critical for some of the folks that we visit with today as well, you'll see a very large sampling of Medicare supplements available to you, and we have tools set up expressly to help you be successful in this area. The ancillary programs in each of those categories, those national leaders are there for you as well, and they make a great way of not only marketing, but also creating additional revenue streams for your agency, but most importantly, taking care of our prospects and clients. You'll note in the lower left-hand corner, there is a MD Live. We're rolling out a telehealth initiative as well to make certain that in these times of COVID-19, we have an opportunity for our prospects and clients to access telehealth if it is not part of their original program, their original base medical program. So when we look at the Medicare opportunity overall, it gives us a great pool of prospects. It gives us a great number of folks that need our help. If you go by aging alone, well, you don't get on one of these programs without someone telling you about the silver tsunami, the aging of the baby boomers, 1 every 10 seconds, 10,000 plus a day. And that's all true, but if you look at Medicare based just on people over the age of 65, your number's going to be off a little bit because some folks reach the age of 65, don't access Medicare in its entirety, may defer it for one reason or another, and so it drives that number down a little bit. But then we need to consider the folks that are on Medicare because of disability, those under the age of 65, and it's about 1/6 to 1/7 of the population. So it's a good chunk of folks that drive up that number that really need our help, and we see that it's all part of a diverse population that sometimes have challenges particularly when they're disabled when it comes to their finances. But they also have to deal with Medicare population as a whole, number of health problems. 2/3 of the population is 3+ chronic illnesses, and many of them have challenges with their income and assets as well, not what they expected to be during their retirement or when they're accessing benefits on Medicare. So a full portfolio of products with a number of choices therein can be very helpful for us, and that same portfolio of products can differentiate ourselves from other people who are looking to access providers and create a relationship there as well. And we'll go through that in just a bit. When someone does become eligible for Medicare, they have choices, much as you have choices as to what you insert into your marketing programs. Someone on Medicare, they don't have to do anything. They can actually decline the optional Part B if they wanted to. Very few do, thankfully. But there's a number of folks that have just Medicare A and B and pick up a Part D program to cover their medications. Others will look at some of the gaps in the coverage and pick up a standardized, modernized Medigap policy, a Medicare supplement plan, and others will choose to go into Medicare Advantage programs, the Part C programs, that are all encompassing of the benefits. It's an interesting choice, and what we see is a fairly even split when people first go into Medicare. So this includes the age-ins and the late to Medicare seniors, and you see that it's a fairly even split. This gives us talking points for our conversations with providers, because we want to make certain that they know that we have programs to support them regardless of the choices that are taken by their patients. We also see a portion of the population that shows as Medicare only. Keep in mind that includes folks that are dual beneficiaries, Medicare, Medicaid. It may be folks on a group retiree plan. It may be folks that are accessing the VA. There are different reasons why someone might come up in this category. One of them may well be they only have original Medicare. So in each of those categories, we want to make certain that we're prepared to handle the needs of the population and work with the providers in order to make certain that they are receiving the compensation they're entitled to by taking care of our prospects and clients. Because it's a very diverse population, obviously. You see different numbers come through, now over 60 million people supposedly on Medicare, and they all have different needs. So we need to look at the situation they're in, reason within our mind as to where they're accessing care, and approach those individuals to help them cover their patients or take care of their people. Because it is the Medicare world, it's got its own language, much like any industry where it seems like we're talking in code. But Medicare has a virtual plethora of acronyms. And one of the things that you'll receive as follow-up to today's presentation is a guide to those acronyms. So you can click on a link and, boy, what does EOB mean? Pop up and you can find that. So it's available to you as well. Because we deal also with a population that's regulated as to when we can speak to them, knowing those different enrollment periods, the basic enrollment periods as shown here, give us a bit of a talking point, a sales track in the manner of speaking, when we approach the folks that are providing the care, to make certain that they realize that even though there are standardized election periods, OEP doesn't have a big factor for many of them because it's an MA to MA type of program in a manner of speaking, and you can't advertise for it anyway, contrary to what a couple of Facebook ads I've seen here lately. It's something we need to make certain that we realize that while it's there and we can take advantage of it, we can't market to it, but we have a ton of other things that can help. So some of the things that we're prohibited from doing during OEP can be addressed by the special election periods, and knowing those special election periods give us the wherewithal to speak to our providers on an intelligent basis. Because many of them will think, well, gee, open enrollment's over, AEP's done, what do I do? I mean, we can't help our people. Well, a little bit of education might help there, because there's a ton of SEPs that are available, and in addition to the basics that are listed here, we have a number of special election periods based on weather circumstances. And so that information will come to you as follow-up as well. One of the things that we also see is during this time period, it's OEP. Many people will say, well, we've just come out of a period. They've just investigated their coverage. Well, Kaiser Family Foundation tells us that more than half of the people on Medicare don't compare their coverage options annually. They haven't responded to outreach for one way or another, and we'll see that this can cause a challenge because the plans can and do change year over year, including the all-important coverage for medications. And it particularly affects different segments of the market as well. For those of you who are active in the lower income market, the folks that pursue the DSNP, the Dual Special Needs Program, or work with folks that have certain health conditions, those folks that may qualify for a chronic special needs plan, these are a good portion of the folks that haven't examined their current coverage, and those are the folks that really need it the most because they're the ones incurring a whole bunch of the expense. It's also important to note that this population has some challenges understanding Medicare programs, much as our providers do in many circumstances, where a subject matter expert such as yourself can really help guide them through this process. Keep in mind, many of the support staff that you run into in the different providers' office, some of them may be short-term, some of them may be part-time, but there is a distinct possibility that some of them don't know what they're talking about when it comes to the coverages that are carried by their client base, by their patient base. It's also important to note that while there's a lot of publicity about Medicare.gov, most beneficiaries don't use it. And so having a system in place that can help these people electronically access benefits, it can be all encompassing, all helpful for you. And that's one of the things we'll discuss in a bit as well. So when we talk about licensed insurance agents working with providers, we're looking beyond just the normal property and casualty type of situation where it's an aside. It's also a situation where we're looking to make certain that we examine all of the folks that are delivering care under the Medicare program, so that can be more encompassing than you might think. It's also important to note that these are people that are of great influence to their patients. Obviously, they cannot push one program or another, or supposedly. I've got some different regulations. We'll address that distinctly. But they can be even more influential than family members when it comes to different choices that are available to them. They can be a trusted source of referrals. We talk about how we work that angle. And the interaction that they have with their patients and clients can be really revealing because it gives us an opportunity to go into a discussion as to what is a possible best choice for that patient or client. And it's important to note that since we do also work with individuals that aren't on Medicare and folks that are in a position to expand their benefit portfolio, in a manner of speaking, privately, doctors, specialists, dentists, all these different people that you visit in the provider world are potential clients themselves. And that is something that we urge people to investigate once they've established a relationship and the value to that particular office. If that's an area that you are already active in, and that is pursuing business with folks that are of higher income, obviously that doesn't mean you have to delay reaching out to the provider themselves. When we talk about doctors, when we look at physicians, and this can go beyond just the primary care physicians, we can go into a realm of possibilities with the different specialists that are also necessary for a patient's care. We see that doctors can kind of fall into a couple different categories. You have established physicians, and they have a base of patients that they're not looking to expand the patient base, but they're looking for ways to deal with the folks that they already take care of and do so with a clinical analysis, in a manner of speaking, where your personal services that you can deliver to this type of doctor's office can keep that patient base in place and minimize some of the challenges for what in many cases are limited staff when you deal with some of the doctors that have their own practice. You also have the occasion of folks that are just coming into a network, physicians that are being added that haven't been active in the space. We don't see as much of that anymore as we did earlier in the millennia. Gee, that made it sound old. But you also see different folks here that if they're coming into a clinic type of setting or a office with multiple physicians, they don't have some of the same challenges that a solo practitioner would, where in many cases they have minimal staff. And if they do have staff, and many times it's important for us to be able to educate that particular population because they may be new to the insurance world as well. When we look at other common providers, we look at pharmacists, and they have much of the same challenges that you see with physicians, with a bit of a tweak. Because even if they're new to the profession or they're an established pharmacist, many of them also have to deal with corporate directives. The pharmacy world is dominated by certain entities, and you'll see that in those circumstances, they ought to deal not only with the patient base, with the folks that are accessing their medications through their location, they're also dealing with different corporate directives. And we'll talk about how we can influence that in just a bit. When you look at dentists, this is an area where some folks have overlooked this as a possibility of working with them as a provider. It's something that we see as similar type of circumstance between dentists and the physicians that come into play, because these folks generally, you don't see a huge office. You don't see generally a office with 6 dentists in it. You'll see much more frequently the solo practitioner in this space, and they are not as accustomed to some of the network pieces that come into play as you see with physicians. It's not that they don't deal with it. It's just that you don't see as many dental maintenance organizations as you do health maintenance organizations. These folks, in many circumstances, also have some challenges with how much staff they can afford, but they also have a difference too, because many of them work on a fee-for-service type of basis. So they're billing basically for what services they deliver on that visit, and they are then tasked with a accounts receivable dilemma to a degree, where they want to make certain that they are collecting the fees that they're entitled to, and you have packages within your portfolio that can help them do so. When we look at some of the other folks that sometimes you don't think of initially when it comes to providers on the care that is being delivered, you really need to, otherwise these folks can really knock you out of the box. But these are folks that are delivering care to our patients that are on Medicare, and in many circumstances don't fully understand how they're being paid. So we want to make certain that these network providers of both durable medical equipment, pardon me for that acronym up there that I didn't lay out, and home health agencies, sometimes part of their services, particularly with home health for custodial care, are covered by Medicaid and not Medicare. So visiting with some of these folks and creating a relationship can not only enlighten them on proper billing practices, but it gives you an opportunity to also affiliate with, well, folks that are in their house quite a bit in certain circumstances. If you have custodial care being delivered in the house, generally we know that's covered by Medicaid and not Medicare, but those folks and folks that are performing services that are covered by Medicare itself visit with these people at a much greater frequency than we ever will. And so they have relationships that can be helpful for all involved as well, as long as we work for a common goal of taking care of those patients. You also have those big buildings where people wind up upon occasion, those hospitals, and they have different staff that can be very useful for you. And depending upon the program and the area and the facility, they can be damaging to you as well. You'll find that most hospitals have social workers that help deal with services post-discharge, and some of those folks may not understand the benefits that come with a managed care program, and they can disenroll some folks if you're not careful. It also, however, gives you the opportunity to visit with these people and go through the packages that are available, the different types and generalities, and then specifics thereafter about how care is delivered through Medicare Advantage plans. We have a much better educational depth than we've had in the past, where many of these folks are aware of the network requirements and the benefits that people get by having some of the managed care programs. But that's a great group to address. I used to have meetings in conjunction with a long-term care agent that we offered continuing education credit, and that way we could address groups of these social workers, because most circumstances they require continuing education as well. So that's something to consider. We also have in hospitals different support groups. In the Dallas area, there's a program called Better Breathers for those folks who have cardiopulmonary disorder. And in many circumstances, these groups meet at the hospital and have need of someone to deliver educational topics to them. So having a presentation and the willingness to address a group, when we get back to a full real reality, I guess, it gives you then the opportunity to speak to a number of people that are perhaps caregivers for some of the patients. And for those of you who are adept at rolling into other products outside of just base medical or ancillary programs, and I speak particularly to the folks who are active in the long-term care space, it gives you an opportunity not only to speak to the actual patients, but the caregivers who can influence that decision, and the folks that may be eligible for other programs that you offer as part of your product portfolio and the depth of the practice that you deliver from your insurance agency. Because many of those folks need help as well. And we need to make certain that we're addressing all aspects of the delivery of care for the programs that we're selling. Where do you find them? Well, you can find a ton of them all over. You can go door knocking with docs if you want and set up appointments. Not exactly advisable in today's current environment, since many of their visits, even with their patients, are done telephonically or electronically. But one of the things that is a very base benefit for many individuals is pulling out that provider directory that you have with plans that you work with. This gives you a listing and contact information of insurance professionals that may be willing to work with you to deliver benefits to their patient population. There are also ways that you can access information through professional associations. If you want to inquire with the American Medical Association, you can get information there as well. You have, of course, two different Chamber of Commerce guides that are available, and industry periodicals that we can look at as well. If you're looking for a list of any sort, well, you can most certainly buy one if you choose to do so. And this gives you, however, a little bit more of an influence as to specifics of the list that you're looking to purchase. So you can narrow down your focus and look at certain specialties perhaps, or different providers of care in a different area, and run with that. However, there is the joy of the internet, search engine power. You can pop in providers in this zip code, doctors in this zip code, and of course, you have somewhat of a ready-made list just off of the internet. And while we don't see it as much as we used to, Yellow Pages, they still do advertisements. You don't see a lot of the paper delivered anymore, but you do see that same sort of capability online as well. And it might be helpful to you as a source of providers that are actually not only just listed in the Yellow Pages, but perhaps still buying advertisement. That gives you an indication that those folks are looking to grow their practice, to grow their business, and they may be very well great prospects to work with in your efforts to market as well. So when we look at some of the things that are just generalities, some basic tips for success, it's important for us to dress and act professionally and dazzle them with our smile. I know that sounds so basic, but that's the old expression, you don't have a second chance to make a good first impression. Creating that image your professional demeanor can help across the board with everyone in that office, including that gatekeeper at the front desk. They're crucial to our experience, and we are, for those people, just another salesperson. Oh my goodness, another drug rep. Oh my Lord, another insurance guy. If we differentiate ourselves with a smile, with an approach, make those people feel as important as they are, it's a huge difference as to whether or not you actually have a chance in a particular location. And sometimes we've got to realize that despite the overall feeling in our society of, hey, it's a microwave type of move, we got to have it now, sometimes it takes a little bit to establish that relationship and make certain that these chosen target providers know who you are, know that you're consistent, know that you are delivering upon different values that you bring to them, and it makes a huge difference just by following certain business protocol. You go in, don't necessarily demand a appointment at the first approach. If you're doing it face-to-face in the future, or if you're approaching telephonically, the same sort of circumstance. And telephonic presentations actually may give you a better shot at the office manager, the administrator of the practice, those sorts of things. And if you schedule appointments based off of that, it's really critical that we are on time or early to go through our discussion of the programs that we offer. So once again, as we approach the office and we have that person at the front desk, that gatekeeper, they act in many circumstances just like if you were cold calling into businesses. You know, that person that answers the phone, they can be your best friend, or they can be your sentencing to damnation in a manner of speaking. It is an opportunity for us, if we create that relationship and we respect that person's duties that they have and provide them items of interest and value that help them with their job, it can be a huge advantage to you. It's important to note that in today's electronic world, we don't see as many benefit packages being left behind. The brochures, not the brochures, the sales packets is what I'm after here. If you did, regulations say they shouldn't have apps in them. But since we do so much of everything electronically, we need to go about and create that expectation that some of this, a lot of this, may be done virtually. So having electronic flyers available and delivering a flyer, many times on a generic basis that just said you need help with Medicare, goes through some basics. You see these off of different sales kits with the different carriers that are out there. I'll work up one and send it along as part of the follow-up. But this gives that staff an opportunity to remind themselves that, hey, I've got an 8 by 11.5 flyer here. Oh, gee, I remember this guy. This is what he does. And you can actually also do certain things to insert yourself into that office structure in a manner of speaking by, hey, there's a candy bar a candy jar with sugarless candy for your patients or for the staff. Many of the carriers have different, what we used to call tchotchkes, giveaways, gimmies, that can be very helpful to them. When I had my route of docs that I attended on a regular basis, one of the things that I wanted to make certain that I delivered were ink pens, because you never can have enough ink pens. They can walk off everywhere. They have your name and number on them, and you can get some pens fairly inexpensively like that. It's a great way for your business to travel with them. There are also the little giveaways that many of the carriers will provide, or create a possibility for you to purchase on a basis, includes like chapsticks or pill boxes, those sorts of things that can be nice little giveaways. You can personalize them, obviously, if you purchase them. In many circumstances, the carriers will help you with those, give you a supply that can be helpful. Pill boxes were always a big thing back in my day of going into those offices, because they run across medications all the time. They want to help their patients keep them straight, those sorts of things. And it's an idea of utilizing some different ways of being different. Create an image for yourself and deliver upon what you're speaking to. This may seem like a really remedial slide, but it's amazing how many people skip past the process of getting to know that staff. If they reveal to you, obviously, that they've been there for a period of time, it's a great way for you to build on a relationship with folks that have seen a few things and recognize some of the things that you can do for them. And proper communication with that staff, be it one or two people, the front desk person and the nurse, whatever, or a staff of 30 in a multiple location, multiple physician type of setting. And those people can be the make or break for you. And that brings about the need of being professional and creating that relationship with that staff, the office managers. If it's a big office, many times visiting with folks that are in charge of patient services or the overall office manager or administrator. In a lot of circumstances now, we see doctors that practice in multiple locations, and that's usually an indication for us that there is a central administrator of different dissemination of information to those offices that can be crucial for us as a key contact for multiple locations in a singular presentation. And being able to touch those people and deliver upon the promises that are there that you can deliver, and we'll talk about those specifically in a second, can make a huge difference. And it's also amazing, just a simple, basic thing. Everybody likes being called by their name. So it's important for us to create that relationship and make certain that we are able to accommodate their request when reasonable, and we're able to help them with the delivery of care within their area of expertise. Many times, if you've approached an individual, a physician or provider or whatever it happens to be, because they're part of a particular health plan and you have the support of that carrier, that can create a huge difference for you. You'll find that many of the carriers are doing provider outreach as well. They may be assigning doctors to different agents to different offices. Doesn't mean that's a solo type of can't get in because they got someone assigned there. Because in many circumstances, if you have a carrier doing it on their own, obviously they're only speaking to their programs. They may give the provider some additional information on assistance programs or different types of insurance plans that are there. But because you're an independent agent and you can represent multiple carriers, if you visit, for example, a doctor's office and they have information out on one carrier and you know that they contract with multiple carriers, that's a great in for you, because doctors don't have to pursue the information for all of the programs that are out there. But if it's made available to them, they need to display it. They're required to display it. And because you are an independent agent and you have generic material available to you as well, you can become the one trick pony for that office. Hey, I represent multiple companies, multiple ways of covering their benefits. I can do a thorough review. And much as you, Dr. Smith, don't just prescribe something when you walk into a patient's examination room. You go through and you ask questions and you determine and diagnose. I do much of the same thing in the insurance world, and I want to make certain that we're delivering upon the proper coverage for your prospects and clients. And doing so, that requires, in addition to establishing that relationship, learning more about a particular practice. You can find out a whole bunch of different things by looking at advertisements or some of the things that the office may be doing to publicize their services, and knowing about that and referencing it during a conversation can be very, very important. But in many cases, that advertisement doesn't tell you much about the provider's mentality, what they're looking to do with their practice. Is it at a patient base that, hey, this is as much as I can handle? I just want to make certain that these people are taken care of. Or it may be, hey, I need help growing my practice. So it's a little different philosophy, and it gives you then an opportunity for multiple approaches. It's also kind of interesting to see how they actually publicize their office's services. In many cases, if they're in an office with a number of other physicians, they may not be doing anything at all. Certain markets, however, will sell advertisements and rank different providers. Here in the Dallas-Fort Worth area, D Magazine comes out with Best Doctors every October, and it gives us then an opportunity to look at that as an outreach possibility, but it also gives you the realization that some of them are buying ads in those magazines, and those are folks that are looking to actively grow their practice. So knowing some of that information and discussing the motivation behind a doctor's practice can make a huge difference, any type of provider's practice. Excuse me. It's also important to note, we ran through very quickly those different enrollment periods, making folks realize that there are obviously special circumstances for special individuals, special election periods that allow us to work year-round. In many cases, the opportunities we have for reaching a great amount of people, specifically some subset of the market that's being served by that provider, being knowledgeable in that area and being able to deliver on those services can make a huge difference. So if you're going in to speak to chronic illnesses, that might be of greater appeal to one doctor or another, depending upon how many folks he has to deal with or she has to deal with and what those special health circumstances are. But it also gives an opening for the folks that are dual beneficiaries, folks that are accessing care through both Medicare and Medicaid, or as importantly for us in these circumstances, what we refer to as the near poor. So these are folks that are getting some help on their medications or may qualify for getting some help on their medications and don't have it in play, and are approaching with educational information on the extra help programs, the low-income subsidy, or the Medicare savings programs, can make a huge difference to the practice. So that means we need to be knowledgeable in those areas as well. And we also have to be cognizant of the fact that we need to be flexible, because there's no one solution for any one person. You know, it's not a blanket type of application where you can paint the entire patient base with one color, because they all have different circumstances, and we want to deliver upon the means for them to best access their care and have the coverage they need. So we need the right product for the right person at the right time, and that then brings about a greater emphasis on the fact we need a portfolio to cover it, because for some patients, a network just doesn't work. And that might be a small percentage of those patients, but it's important that the doctor knows, that the office knows, that we have that variety of programs that can help them with the coverages, and we work to make certain that we connect the patients to the product that may best serve their needs and the needs of their provider. Whoops, went flying by. So here, once again, when we look at different products that we need to be discussing, poking at the product itself and delivering the information as to some of these ancillary benefits, a lot of the social determinant of health benefits that we're seeing, having a greater emphasis in different managed care programs, many times those folks have a transportation benefit. And this can be very helpful to a provider, because that means fewer missed appointments for a patient. And remember, a doc, you've been to physicians it seems like you got 2 minutes with them, but you wait around a whole bunch. Well, they pack their schedules because they have to. And these types of additional benefits can make certain that they're seeing the patients that are there for them. And being knowledgeable about those assistance programs can help them stay adherent to the prescription regimen that they are prescribing for their patients. And that, if they are part of a group, can be a huge difference for them, because sometimes an association with a medical group requires different checkoffs on different programs. And if they are delivering upon a number of samples to their patients, great, it helps them with the money, but you got to document that in your system to make certain that insurance carriers and other folks realize they're delivering upon their prescriptions. And if they don't have an actual working relationship with a pharmacy that is the supplier of those medications and they do a lot of samples, it can be an interesting situation for them down the road. It's also important to note that in many markets, there are certain key providers that aren't part of any network and are being able to identify these individuals and speak to them in a fashion that, well, if they're not part of a network, we got to approach this perhaps a little bit differently, because if they're not in a network, they might lose their patients. So what do we have that can take care of these people? If you're in the Medicare world, you got the Medicare Advantage. Sure, that's the network-based stuff, but you got Medicare supplements as well. And sometimes having these providers be aware of the fact that you have other programs that can help with coverage, that you deliver on them, because, hey, their offices are filing on those anyway all the time. Your diagnoses of those different coverages can make a difference, because, gee, if they're in there and they're not part of the network, and that person can no longer afford their Medicare supplement plan that they currently have, doing an analysis of other supplements available in that area can help ease that financial commitment and can make a difference not only to that patient, obviously, but to the provider of that care. Some of the things that we see when you first go into a practice, and you can kind of tweak this, not twerk, that's a bad dance from what I understand, tweak this approach if you're doing it telephonically or electronically, and that is making certain that you're doing some things consistently and you're bringing value to that organization that you're approaching. So giving them the different information about the benefits that are available. And if that office is looking to grow their practice, some of the things in the community that they can participate in order to create additional awareness of them and what they offer the community as well. And since in many circumstances, it may be a new provider to an organization, to a health plan, or it might be someone that needs kind of a refresh, offering the lunch and learns or delivering upon a off-hour type of presentation to the staff and educating them as to the different choices that are available to those patient bases. Well, it not only helps ingratiate yourself into that practice, but it gives you the possibility of dealing with the people you're talking with and their loved ones and the coverages that they have and need. Some other basics that we see that can be very effective is going old school on the follow-up. And that is basically a handwritten thank you in a language other than Chickenese. You have to be careful. If you, like me, I tend to go fast and my handwriting gets sloppier. We want to make certain that those folks know we appreciate the relationship that we've initiated and hope to deepen. And we do so by being courteous, delivering upon some basics, making regular visits, either telephonically or in person nowadays, mostly telephonically, to make them aware of the fact that you're there to help them with their patients and some of the challenges that they're seeing. It also gives you an opportunity to build that relationship, because if it is a network-based program and you're approaching a physician that you've actually enrolled patients with, keeping that information available and reminding that office of the fact that, hey, you're helping them grow their practice. You want to make certain that you are communicating properly what the provider does for them and the important philosophies of their office, as was referenced on a previous slide. It gives you then the opportunity that that doctor knows that you are helping them grow their practice or maintain their practice as well. Otherwise, that can be a great area of anonymity. You know, like, oh gosh, I got another person that's on Cigna. Oh, here's a United Healthcare person. You don't always ask who helped them with that coverage. And if you're helping them, enlighten them to the fact that you are an individual helping them maintain their practice, that can make a big difference. That list is a topic of conversation, particularly if you target one area. And in many cases now, we're seeing many more physicians who ally with a particular medical group. And some of those medical groups will endorse certain health plans as well. And having them know that you are a licensed, certified, appointed individual with that health plan can make you a key mover, in a manner of speaking, in delivering the care indirectly through that office. Regulations. Boy, it's always nice to have rules, isn't it? Some people choose to ignore them. Some people go overboard with them. But these are different segments of the Medicare communication and marketing guidelines that are delivered each year by CMS to the general population. You can find them online. I pulled out the different regulations here that deal a lot with marketing with providers in a healthcare setting that are governed by Medicare requirements or plan requirements. And so it gives us an idea as to what we can and cannot do with doctors and specialists in hospitals and other folks in a healthcare setting. It's important to note that Medicare places a great emphasis on the fact that we are not to impede the provider-patient relationship, and there are certain activities that they will view that are provider-initiated or plan-initiated, and they have different regulations that come into play. When we look specifically about dealing with folks beyond the medical, the doctors and specialists, and we go into the pharmacy world, we have to realize, of course, that if that provider is initiating some of the marketing activity, there are things they can do that we cannot. And there are certain things that we can assist with and we cannot. And so it's important to note that if a plan is asking them to do specific activities, that falls under a category of not being provider initiated. Obviously, it's a plan initiated practice, and so there are different regulations that come into play. Pardon me, frog jumped in my throat. Some of the things that we look at that are based on information that are initiated by the plan or the Part D sponsor, that gives us an opportunity to use generic material or plan-specific material to help with that education process. And for these, the plan is going to do some overseeing of what you're doing as well. So if you're going in on a generic basis, so to speak, as with multiple carriers, when you visit with them specifically about a specific carrier, that carrier is responsible for your activity. And that's why you see so many insurance companies careful about who they'll send into different provider offices or who they want to work with in those circumstances, because an ill-trained or ill-advised, good-intended insurance agent can really kind of muddy the waters there, and we have to be careful about what we do. And that's why it's important to make certain that we have our plan in place and we know what we're going to address with the providers. Having a simple checklist can be marvelous to keep us in line as to what we can and cannot say. Pardon me. So it's important to note that the carriers can't ask the doctors or providers to do specific things. And in today's much more regulated world, we have different forms we have to complete, different things that we need to collect before discussion, and the plan sponsors cannot ask the provider to collect that scope of appointment or application. It is also important for us to note that those providers can't do like phone drives for driving an individual into a specific singular plan based on interest of that provider. And they are also prohibited from mailing certain marketing materials on behalf of the plan itself. They can obviously mail a letter of introduction or a letter that speaks to the different programs that they offer and refer to them in generalities. But when they start mailing out, oh boy, here's the packet, not good. It's also important to note that some of the draws that we see in some of the community activities kind of been on kibosh here, on hiatus for almost the last year or so, but the different health fairs and different things like that, because there may be health screenings that are conducted at such activities, it affects what we can do with the collection of information at those events. We can obviously give them contact information, but specifics on different programs where a screening is being conducted, that's a no-no. And we also have to make certain that there aren't little extra incentives that would drive someone to select one plan or another. So an inducement of any sort to enroll in a particular program, can't do that either. And they cannot accept additional compensation from the plan for any of that marketing activity that is done at their own behest. Some things that they can do, well, they can make the information available on the different programs. A lot of this is targeted toward the doctors and specialists. We don't have some of the same requirements when we reach out to, let's say, pharmacists or folks that are in a different type of structure because they have different types of oversight. It's also important to note that these docs can help you publicize different events, or if you are one of those individuals that, if the world ever gets back to normal and we can do some of this, you can do a camp at a particular provider's location as long as it's in an area that is not delivering care. So those flyers that can be made available, it's important for us to have them at the ready for our approach with these different providers because they can make that available to their patients. You'll see in many cases, you'll walk into a doctor's office, they got a wall of acrylic stands there with different information programs that are out there. Some of it is health condition information, which brings up the fact that if you have an association with American Heart Association, you can help use their material to deliver upon educational information for a location. Great way to become involved in the community, volunteer, and have information for you to use. So different things that come into play. This does note the fact that CMS does not expect providers to proactively contact all participating plans. So that was my point earlier in the presentation where we were talking about having multiple affiliations with multiple insurance companies and they've only got one plan's information out there. Well, if you're contracted with some of the others, you can deliver upon that information, and those providers are to display it. So it gives us then the direction of we got to be careful as to what material we're leaving behind as well. With so much of the emphasis being out there with electronic applications and doing things in an electronic fashion, having information that is more of a general nature that predicates that discussion can make a huge difference. And that's how you get to talk to a lot of people. And these folks need to be aware of the fact that as a provider, they're supposed to be neutral as to the different choices that are out there that are coverage options for their patients. So as an independent agent, you then have the opportunity to do that analysis of those different programs for an individual and help them with information that can bring about a choice as to their coverage throughout the year. It's also important to note that these materials now have a greater access throughout an office because the material itself can be delivered there, and we have a kind of a lessening of some of the oversight as to it's got to be here, it can't be here type of thing when it comes to base information. It also makes certain the fact that we have to make sure that we're following the rules because you have a whole bunch of people involved in these marketing activities. If you're doing something wrong, you have a whole bunch of people that can rat you out in a manner of speaking. And we want to create the image, truthful image, that we're there to help them and we're following the rules and regulations that are set for us. So remember, once again, providers need to be neutral in this space. They can't collect the scopes. They can't mail specific marketing activity based on the plan, and they can't make calls or steer patients in any way. We are there to deliver upon that information, and the plan itself needs to have that oversight. Once again, the slide is kind of repetitious of an earlier one, but I wanted to emphasize the fact that they have to adhere to the regulations as well. And the plan then is one of those that, hey, their provider relations department, if they're making their sweeps through contracted providers, which many of them do periodically, they're going to check on how different things are being handled. And it's also important to note that as doctors come into a network or accept a new program, they can do announcements of that program and direct those calls to a multitude of individuals who can help with that decision. I received a letter this past fall from a doctor for the patient or for the person who used to live in my house before I got here 10 years ago, and I just got that letter this week. Gee, that doc needs to update their files. But they can do that kind of outreach, and the letter itself was compliant and listed an agent's name and number for them to handle the questions that they have on enrollment choices. So they can do that. And you will see also, in addition to being new to a particular program, that they can also do a announcement of here's the plans that we accept. And you'll see some of this activity sometimes throughout the year if a group is negotiating with a plan and is either adding or dropping one. So it's important that we make our friends, our compatriots within our relationship aware of some of the things they can do to announce what they can and cannot do as well. Excuse me. It's also important to note that a provider is not to give you a list of their patients. Even if they gave it to you, you couldn't contact them other than through a general mailing. You couldn't use it independent of that provider. You can't cold call it, most certainly, because we're talking about HIPAA regulations here as well. And so we need to make certain that we also help that provider protect the personal health information, the PHI, the PII of that particular location. Nice acronyms there. We're going to have to look them up in that guide when we get it. But it gives us then the opportunity to not only make them aware of the fact that you are one of the options as a source of information as designated by the government, because they can send people to a SHIP counselor, they can talk about state Medicaid, they can send them to the Social Security office, or they can actually work with a plan marketing representative such as yourself to deliver on that information. So that same sort of mindset can carry over when we speak to the pharmacist and some of the things that they can and cannot do. Obviously, in the world of big companies now, you have corporate directives that you need to work with. But it's important to note that even if corporate was involved, that relationship you have with that provider is also important. For those of you who have worked retail campaigns with pharmacies, you recognize the fact that you got a relationship with that staff, you got a relationship with management of that location. That can determine your success in a retail setting as well. It also, throughout the year, we have an opportunity with more chronic SNPs being made available, chronic special needs programs. Those affiliations can be publicized as well, and we have to make certain that we follow the regulations that are there in play for them. Because if they're gonna talk about expecting or accepting, I should say, one special needs plan, they need to list all of them as well, much as the previous letter announcing affiliation with plans in general. Some of the things that you can do, we kind of referenced before, make some of that information available, plan specific or generic. If you are open to the camp, and they are as well, you can create that marketing activity, set it up on a regular basis. Hey, you have an insurance professional here that's going to be here the second Tuesday of every month, or whatever it happens to be. It's also important to note that if we go into an office, we see material there, and we look to leave our own material, we got to have permission to do so, obviously. It's not like someone stuffing a flyer in your mailbox or parking it on your door. Being that source of education or a resource for the staff is hugely important, because it helps everyone understand the basics of the program and how you can tie that patient to that provider. There's always circumstances where a divorce is imminent, we'll put it that way, but having the information and delivering it to help with not only your relationship with that provider, but the provider's relationship with their patient, that makes a big difference, and it creates a different value proposition for you entirely. It's also important to note that we all have bad days. I realize I'm at the top of the hour. I'm going to hurry through some of these slides here, but you may be the dumping ground. If you come in and say, hey, I'm an independent agent, I represent these companies, and the first words out of someone's mouth is, I hate that company. Well, find out why, and then work with the company to perhaps ease that tension or create a better relationship as well. And since none of us are omniscient, we have to make certain that they know there are certain questions we can't answer, but we will get them the answers, and work with a carrier's provider services department to help in that area. How do you find those people? Well, if you got an agent manager in an area for a particular company and they don't know that a provider is not happy, having that information can be very helpful, because they can use their resources internally and perhaps set you up with a meeting of the different provider services within that carrier to solidify that relationship, and basically you solve a problem for that provider. Staying on top of that is very important, because all the providers will look at and appreciate a genuine effort on your part to help them with their practice. And you do so by acting professionally, building the trust, following up, and earning the respect of those folks that you're visiting with. So when you take this from the doctors and also speak to pharmacists, they have many of the same challenges that you have. When you deal with pharmacists, however, knowing low-income subsidy, extra help programs for help with medications is crucial. You're looked at completely differently in that circumstance. And having them realize that you're doing an analysis of the programs that are available to them, well, gee, that's a differentiator between you and some of the other people that just come a knocking in their plaid coat, asking them to buy a watch. Hello, Herb Tarlick. Nope, that ain't it. We're out there delivering basic value propositions to the pharmacist as well, because they have some challenges too. You'll note the lines if you go pick up your own prescription sometimes, where part of that is due to the fact that you have a staff member or a pharmacist discussing different topics. Now, obviously, if it's about the medication itself, there's not a lot you can do to help there. But when it comes to paying for that medication, that can be a big differentiator. So knowing that you can deliver the information on those assistance programs for the cost of the drugs, well, that makes a huge difference. Because keep in mind, you're establishing that professional or behavior not only helps the client of that pharmacy, or the buyer through that pharmacy, but the pharmacist can then become aware of it as well, and you may become their personal advisor. And that is similar to what you do with relationships with doctors or other professionals in these different delivery of care models. It is an opportunity for you to visit with them about some additional coverage they may need that you can deliver personally to that provider. Because if you are one of those folks that are involved in market venue programs, retail programs, I don't care if it's the initiative through Walmart itself, or is it a carrier directed program that has multiple type of vendors in their retail program. If you're doing that just for AEP, I'm going to get up on my big old soapbox and say shame on you, because that gives you an opportunity to work year-round with those folks, and you always have people moving in, aging in, and you can make a difference. Dentist. Don't forget the dentist, particularly if there is a benefit through one of the packages that are available to you, but you also have the opportunity to deliver upon those programs a person can buy in addition to whatever coverage they have. If it's nothing, or if it's something delivered by a managed care program. So standalone dental, vision, hearing products can make a huge difference. That brings about, in addition to the dentist, the vision professionals, the ophthalmologist, the optometrist, and the audiologist that can be key providers for you as well. And these folks have a different scenario, as we visited earlier, about what means they have for their accounts receivable. Because the fee-for-service programs, for the most part, pay directly to the patient, and it gives them the opportunity to make certain that they can pay the provider of care, particularly the dentist. And dentists are also valued professionals in the community with disposable income that we can approach for their own personal needs as well. Big point, because there's a whole bunch of people on Medicare that don't have coverage, 2/3 of them. A whole bunch of people that want coverage, have some from a Medicare Advantage plan, but perhaps not enough. And even the full dualies may not have enough coverage to deliver upon the needs they have. How often do you hear, man, I can't buy dentures, don't have enough money? They have different coverages there. They can discount that, make it available, and pay in addition to whatever else layer on. It can make a huge difference to those people. And you have carriers that will actually help with different marketing material as well in an approach to dentists. This is an example from Medical. And you'll see that these organizations may also have different dedicated campaigns to help in this area. Specifically, you'll see a lot of the dual SNP programs have campaigns that market through dentists. Keep that in mind. You're approaching a dentist, but your end game basically is to help them with their medical coverages as well. And keep in mind that the world is different now. We're in a new normal, and we need to make certain that we're able to deliver upon this information either in person or virtually. So being aware of the fact that these providers are training your people on an electronic basis. Hey, during the whole social isolation, I've got one doctor that I've seen 7 times I've never seen other than on my smartphone. So you can deliver upon information that is made available because your doctors and other specialists are training your folks to do things electronically as well. And that is a huge differentiator even into hospital settings. There's a recent survey that came out that says that 76% of the U.S. hospitals connect with patients and their practitioners at a distance through electronic means. So it's not just doctors, it's hospitals as well and other medical professionals, because I was actually on a recent webinar from the oral health advocates that touched upon the fact that teledentistry is actually a growing piece. Not nearly as pervasive as we see on the medical side, but a lot of the upfront stuff is being done electronically, and that then makes us aware that we can reach out electronically as well. And the folks we're dealing with, they're getting better at it. They're being trained by multiple places as to accessing care. We see a whole lot of virtual visits when it comes to us discussing their different healthcare options. And there are a ton of platforms out there available without cost that can facilitate that sort of discussion. So it's all a case of doing our job in a manner of speaking in a professional manner and delivering the value that comes from the services that we're capable of. And those magical words of thank you can make a huge difference. In closing, a couple of quick things. We can help you be prepared for the variety of products that are necessary to address these groups, because you need options. And the Assurance Bay program allows you to create an agent profile and contract with multiple carriers electronically. So you don't have to fill out a ton of different contracts. It can be done through this system, and it's done electronically and made it easier for you. Since many of these carriers, vast majority of them, about all of them now, require errors and admissions coverage, we can help you with that too. We got a program in place that you can purchase a program that covers you regardless of the insurance program that you're visiting about and with whom you contract. So it's good with whomever you're working with to market different programs. We'd like it to be us, but we realize you're an independent agent and you have options, and this will cover you regardless. We also help protect your license through bundled continuing education credits through WebCE, and you have a program that you can access as well with a modified guarantee issued DI program where you're paid commission upon a product for yourself. So if that's something that you're looking to protect your own income, here's a way to do it. We also deliver upon the electronic access to deliver upon the product itself with your patients in a compliant fashion. Rolled out Medicare Center this past before AEP, comes with that CRM that's part of it, an all-in-one universal login for 3 different types of quote engines that allow you to collect electronic scopes and store them compliantly and deliver upon side-by-side comparisons compliantly of different health plans that are out there. It also gives you the opportunity to use the tool and cross-sell for additional ancillary benefits. So you go in a house, they have a health program they're happy with, they're not going to change, but they need dental coverage. This is a way you can quote and add to that. if they're in a Medicare Advantage program and they're looking for something to help budget for hospital copays, those hospital indemnity programs are wonderful. Much as where today's presentation is being recorded, you have a library of past presentations available on our website and on our YouTube channel. This gives you the opportunity to go back and revisit different presentations about specific carrier products, specific carriers in general, different marketing tips and hints that can help you in those different areas be successful. We also want to make certain that you realize all the compensation that's available to you. Many of the ancillary products will have different trips and incentives that you need a central place as where to go to differentiate between them. And those programs can also help you qualify for Premier's incentive programs, which this last year was intended to be a cruise. Because of the circumstances, turned out to be a pile of cash for a whole bunch of people. So watch for that. We also can help you get in front of folks with different contact lists, different ways of addressing those community-based influencers, including the providers, how you can speak to those opportunities with providers and other centers of influence, like faith-based organizations, a joint campaign with a provider, and how you can inject some of this information into your retail marketing efforts as well. Some of the carriers will actually deliver upon prospects for you or help you also through different marketing support, but we also deliver upon internet leads and direct mail support, where the direct mail is a discount program based on production. It gives you the opportunity to continue on a tried and true marketing technique at a deeply discounted cost, and that way you can do it consistently. Because any type of marketing program it's kind of like your exercise program. You do it once and quit, you feel the pain, you don't see a lot of the benefit out of it. You do it consistently, that's where you see the returns upon your investment of time and money. We do have different preferred lead vendors because we vet the letters that go out to make certain that it's compliant for you. And we also have programs that if you are not able to create a campaign on your own, you can actually purchase returned letters or return responses that say, hey, I'm interested. Differences between these, you create your own mail campaign, you get that return the day it's received. Some of these might be a bit older than that. I'm not saying they're aged, but you know how it is. If you're not able to contact that individual within the first 3 to 5 days, they kind of forget what they're doing. And this gives you a couple of different options to access some of those returns, and the prices will vary according to market and time period. We also have a Facebook campaign for final expense and Medicare leads, and utilizing these type of marketing programs and making our providers know that we're looking to enroll people with them as well can make a big difference. So all that said and done, a quarter past the hour, we're talking about programs where we're looking to work with you to grow your business, and we benefit from it mutually. We want that business with you, and we want to make certain that you are aware of the fact that we'll help deliver upon the promises that we make, and the fact that there are additional pieces, marketing pieces, we can make available to folks that are participating in provider activity, leave behind, those different general flyers that I talked about. There's also a community presentation where you have a leave behind as to who you are, why you're different, why they want to work with you. And as you ask for their business, we're looking to grow our business with you as well. So if this is a possibility or it's something you want to work into your personal marketing plan, we need to have a discussion. There'll be follow-up sent to today's presentation, and the marketer that you're working with within Premier can help you in this initiative. And of course, generalities, we've got a whole bunch of different material available to you to make this effective in your personal marketing plan, be it face-to-face or virtually. Because, hey, it's a different world nowadays. You can reach any of us at Premier through our toll-free number, 1-800-365-8208, or through our website at premiersmi.com. I do want to check for questions, though. And it says, one of the questions says, pardon me, give me a moment here. Does Premier contact our shared clients if an independent agent passes away? I worry I will lose sales if a client thinks I'm a one-person office. We have different programs in play that help you with succession programs. So this is a topic that we deal with where it may involve an LLC to make certain that your renewals go beyond your lifespan in certain circumstances. And there are ways that we can get that done for you, yes. Another one being that most of these strategies are limited due to the pandemic. What have insurance professionals been doing as an effective way to work with providers during this time? Virtually. Same thing that you're doing with your clients in a lot of circumstances or other centers of influence in the community, because we're able to communicate with them electronically. How many Zoom calls have you gone on in the last 6 months? Probably enough to spin your head. Makes you zoom all around, doesn't it? Well, those same type of things are available for us in communication with the providers. And keep in mind, if that provider is part of a medical group, they're doing them all the time anyway, internally. So they're accustomed to it. And it's a great way for us to deliver upon that delivery system to make certain that they are kept abreast of development and of the opportunities you present to them in a working relationship. The next question, I'm having some challenges reading, pardon me today. Provider complaints that are in the client feedback, that's also a great way for us to walk into a situation, help with the provider relations or customer service unit with a carrier to deliver upon a solution and make certain that you reach out to that provider to help them realize that you were a mover and shaker in getting that done for your clients. And those circumstances, it not only ingratiates yourself with the insurance company because you help to resolving a complaint, it also helps you create an image and the reputation with that provider, and of course helps you keep your client as well. So all that said and done, I think I've covered the questions that we didn't have covered through the presentation. I want to thank you for coming on and spending this time for me in a particularly long presentation today. I'm sorry, must be too much caffeine. But keep in mind, we're going to be sending out the follow-up, including a link to today's presentation, a slide deck of it as well, and additional reference material that makes you feel comfortable with having data that you can discuss with these providers as well. Until that opportunity that we have to speak with you again, I'm going to thank you again for your business, for your investment of time, and wish you good selling. Thanks so very much, and we'll talk to you so very soon. Thank you.